did a bull's work amount of work. Les Cardwell, come on up.
Scotland County and Blessings, Fox County. Very grateful to have a clinic in the county. Definitely at one of our early Grown-Knox County meetings. At one of our early Grown-Knox County meetings, a community member come to us and said we needed more health care within the county. It seemed like a long reach. And I called Randy. That's been 2 years ago. We was figuring it up last night. We was talking about it. It's been over 2 years that we started this project. So it's pretty cool to see it come to be. Was trying to, with Grown-Knox County, we had some goals. We was trying to raise standard of living for the county. I think this definitely raises the standard of living for the citizens here in Knox County. I think it's a fabulous thing. We were trying to create jobs within the county, and we definitely accomplished that. We made quality jobs. That was one of the things that some of our early meetings that we started out, we wanted to not just jobs, we wanted quality jobs, and I feel like we definitely accomplished that. I'd like to thank Trevor and Chris Harris with American Family. I'd like to thank Linda Mallett with the state of Missouri, and I'd like to thank Barb Hunsiker. They were tenants in the building through this whole thing. They put in work that was not expected of them. They showed an extraordinary amount of patience. There was days we was making a lot of noise and tracking a lot of stuff in through the building. They were super to work with, and I very much appreciate what you all were able to help us with. I would like to thank Jim Sears. Over 20 years ago, Jim Sears had the foresight to believe in Northeast Missouri. He helped get this building built. Jim was not able to see the building completed, and it was named in his honor after he was killed in the traffic crash. But it definitely goes, what Jim done was above and beyond, and we definitely need to thank Jim and his family for helping to make this all come through. That's pretty much what I have, and Randy's got some words, so Dr. Randy Tobler, CEO of Scotland County.
You know, one of my favorite sayings is that for heavy lifting, many hands make it light lifting. And this is a perfect example of how a community, and in fact a region, is being well served by the many hands that have helped lift this project to fruition. It started with a phone call. I was at the Chris Crindle Mart, it's called, up in Chicago, visiting my son and daughter-in-law 2 years ago. And they got a little angry at me that we had a nice, long conversation. And I said, this is really a great vision that this guy has that wants to really bring great health care and do something really sort of against heavy headwinds in healthcare these days. Peter Drucker, who is the father of modern management, once said that healthcare is probably the most complex industry on the planet. It's true. It's heavy lifting. And with the help of Les's vision, the support of his wife, who I'm sure gave a lot of her time with you away, and Kim and Les and I, along with Kurt Ebers from the Blessing Health System, along with folks from my team, Elisa and Dr. Davis and Ken McMinn, and so many people that too many to mention. Michael Brandon, who helped pay the bills along the way, came up with this vision, and against all odds, here we are today. And I hope that all of you will have a chance to visit it, because this is one of the first of many of our partnerships that we plan on doing with the Blessing Health System. It includes not only this structure, which they partnered with us on, but also staffing it with specialists from the Blessing Physician Group. Scott Kelliker, their boss, is represented here, as well as Randy Jobe from the Hannibal Clinic, and so many people that you'll get to know. And you'll find that the strength of our two organizations together is going to bring an amazing amount of health care with our aligned mission, which is to serve the community's health care and keeping services close to home. We don't want anyone in this community driving any more than they have to achieve their health care. So affordable, accessible, and proximate health care is the goal, and it's a reality today. And I'm so thankful for your vision, Les. I'm thankful for your participation and help and all the support along the way, Maureen, and the guy that pays the bills, Pat Gerbler. And now I'd like to introduce you, and I do need to thank my team too. I mentioned Dr. Davis, our medical director, Lori Nelson, our clinic manager. Raise your hand, Lori. You've been so helpful throughout this big project. Elisa will be working with Shaka Gordon and keeping you apprised of things going on in the community. Michael Brandon, our controller, I mentioned. Ken McMinn and Jonathan Holden, who have done the IT work, as well as so many countless others that have been involved. And of course, our star team, Tabitha Rohr, who is just a fantastic... Between Tabitha and Shannon Rudd, who you all know from the community, and LaDonna Stouffer, right, who you know, I call them patient magnets. Anyone that comes within 50 miles, maybe more, will be like, from the old Star Wars, like a traction beam, just drawing them in. I want to get sick just so they can take care of me. So I'll take my mask off in heavily crowded situations. Thank you all for being here. Thank you all for your community support. And by the way, my door is always open for any suggestions on improvements, anything that we can provide to make this community's health care so much better over the next many years. Thank you so much. Now it's my pleasure to introduce Maureen Khan, my friend, my colleague and partner in bringing great service to our entire region, not only in central western Illinois, but also northeast Missouri. And your vision is exemplary and quite a model for me. And thank you for your support along with your team in this project. Maureen Khan, the CEO of the Blessing Health System.
Thank you, Dr. Tobler. And it's a pleasure to be here today as we celebrate the opening of this clinic here in Edina. And you know, Dr. Tobler is a very hard act to follow if you've ever listened to him on the radio. And he's a very hard man to say no to. You know, when he calls you with a great idea that he has about a clinic. And we have a wonderful board back in Quincy who is very much committed to rural America and rural health care. And they do believe that communities deserve health care in their community. And they want to make sure that everybody can have access to health care where they live. And they believe that it is a core part or core to the fabric of the economy of every community. And so they want to make sure that we work together with communities to help them grow not only their health care, but what's important to the economy of that community. So when Dr. Tobler called and talked to us about this opportunity, we said it makes sense. And so we began to work with them, and Kurt had nothing on his plate that day. So we said, Kurt, here's an opportunity for you. And so Kurt began working with Dr. and his team. And we look forward to our relationship in Memphis as we work closer with them and we work closer with this clinic in helping to grow the healthcare here and learn what's important to this community in their healthcare needs and what will be important to any of the specialties that we need to bring to this area to make sure that you have what you need. Our mission is to improve the health of our communities. And we see that as trying to understand what is the needs of the community first, not just assuming that we understand that. So don't be surprised if you see our team coming out to meet you in the places where you work to begin to understand what's important to you and what's important to your community. And as I got to meet the mayor here, this is her first week in her job, I said, this is an exciting time, not only in healthcare, but it's an exciting time in our country because we are being challenged to transform ourselves. COVID did a lot of things to us, but I hope it is helping us transform our businesses and transform our thinking and looking at doing things different so we can be a very different country and start looking at our businesses very differently as we move forward. And it's a time of change. And I love seeing the youth, because I look at her as very young as I'm getting older, taking on this responsibility. So thank you for letting us be a part of this clinic, and we hope that we can help you serve this community. So I think it's now time to cut the ribbon. Who's got the ribbon and who's got the scissors? I'm not allowed to have anything sharp. I just want you to know I cut somebody once by accident.
Dr. Tobler? Alex? Wes, why don't you get it part of your vision right next to Alex there?
Yeah.
Where's line up here, Lori? Dr. Davis.
Staff, please. Medical director of the clinic here.
I'm trying to tell him.
Kurt is the shepherd of our clinic. He has
Shepherd.
done all of the job here.
You want to do a picture with
Sorry, there's no tape in front of you.
These are not sharp.
Okay, so first we'll take the pictures with the big scissors.
Let's take a picture of the big one.
With the big one.
Smile.
Take your man.
Okay.
Does he cut it with the little ones?
Yeah.
You cut it with the little ones.
All right, here we go. You ready? Woohoo! All right.
Yeah.
And then I had to be
We had a fundraiser. We had to buy.
they keep scratching.
We have refreshments here for everyone too.
Dr. Davis. Let's do it.
What are we going to do?
We're going to do a tour.
Okay. You ready?
We're going to do a tour of the clinic.
Looks great.
Can we keep it all in the same video?
We're like, go around here. His finger was in the wrong spot.
You are looking dapper today.
Thank you.
Okay, you just, I'll follow you.
This is our waiting room. And currently, because of COVID-19, we have dividers here in the waiting room between our chairs, our reception area for checking in for the receptionist. And then patients will be called back into the clinic through this door. We have a lab here where we can draw blood and take urine samples and strep tests and influenza tests, and we can spin down the blood to transport it to Scotland County Hospital for the lab. This is the nurses area, nurses desk, where the nurses will work, and this is the reception area here as well. And we'll go take a look at one of our exam rooms. We have a couple of different kinds of exam rooms. This exam room is equipped with a gynecology table, so we can do prenatal visits or women's health visits. And this exam room is equipped with an osteopathic treatment table so that we can provide manipulative medicine treatments to patients with musculoskeletal complaints. Another regular exam room. Again, we're going to take a look at our staff have a very nice break room here, so area for them to take a break, eat their lunch, and refrigerator to keep food in and stuff. And then the main clinician's office is here in the back of the clinic. Their workstation. That's about it.
Thank you.
Yes, great.
And you are the director here.
Medical director.
And what does that mean?
Well, because it's a rural health clinic, rural health clinics have to have a medical director, but they have to have a physician that's overseeing either a nurse practitioner or a physician assistant. So we have both a nurse practitioner here 4 days a week, Monday, Tuesday, Thursday, Friday. On Wednesday, we're alternating between another nurse practitioner and a physician assistant. And I have to supervise all of them by reviewing their medical records and answering questions for them whenever they have issues. When decisions regarding the clinic, like whether we're going to provide a certain treatment or not, medication or not, are decided, medical director ends up making that decision.
So how often will you be in this office?
I'll be here once every 2 weeks. Most of the time I'll be here on Wednesdays in the afternoon. The days that I come to the nursing home next door and do nursing home rounds, I'll do rounds in the morning and then come over here and see patients during the afternoon. And I have to be on site at least once every 2 weeks to do supervision and review medical records by law.
And when you're not here, Tabitha will be here.
Tabitha will be here. There's one other nurse practitioner, Stephanie Henley Pippert, who has some family in the area. And then the PA is Lois Quinneville. So we're 5 days a week from 8 to 5. We'll be staffed. We accept walk-ins. So, there'll be somebody here. The clinic will be open every day of the week. And then intermittently, I'll be here. There's actually one day coming up because somebody's going to be gone that I'm going to be here for the whole day and see patients all day long here as well.
How much of a challenge was it to make this happen? There was a lot of moving parts.
Yeah, it was challenging because as we've visited before at Scotland County Hospital, we're not flush with cash to take on a capital project like this, and that's where Blessing Hospital played a very important role. Les reached out to us and Grow Knox County reached out to us saying they needed a clinic. Blessing a little far away and didn't really want to put their own clinic here at that time. It was really in our service area, and so we wanted to have a clinic here, and because I had patients at the nursing home, it really kind of made sense for us to serve Knox County and Edina as well. But the issue with finances and the ability to build out this space made it challenging. So we partnered with Blessing, and essentially Blessing leases the space and from Les, called Cardwell, and put up the money to do the renovations. And then we are subleasing it, from Blessing essentially slowly over time. Our relationship, because we're in a management agreement with them, at Scotland County Hospital also allows them to bring specialists over here. So beginning hopefully in the next couple of months, we'll start having a specialist here in the clinic, and probably multiple. Like we'd like to have cardiology here maybe 1 day a week. We'd like to have orthopedic surgery here maybe once every 2 weeks, possibly urology here. And so they'd have a clinic instead of patients from here having to drive to Quincy and see their specialist. If we have enough to serve, to meet the needs of a 1 day clinic, that they'll be here and see patients here.
And then just one more thing, tell me about, because this is a prospective game changer for residents at the nursing home.
Yes.
Huge difference between having to transport to often very far away. What are some of the changes that these residents are going to be able to see who are able to come to this clinic?
One of the most immediate things will happen is that right now, when most of the time I'm in Memphis and the rest of the physicians that care for patients there are in Kirksville, the nursing staff there, if they have an issue with a patient, like they're ill or they have a condition change, they call us or they send us a fax or something like that, and then we do what kind of assessment we can through the nurses, and then we either provide treatment, or we may say, you need to take them to an emergency department, or you need to bring them to an office, which means they have to transport them. With our clinicians here, Tabitha, Stephanie Henley Pippert, Lois, all have excellent experience in working with nursing home patients. They've worked with me in the different nursing homes that I've worked with. Now, when they call and they have a problem, the nurse here, the clinician, nurse practitioner, PA, or me, will just run over there and see the patients. And that's going to be available 5 days a week. So much of the care that they need and the evaluation that they need can be done in person rather than over the phone or through a virtual visit or whatever. But the other thing is, when I come down and do rounds, if somebody's got a skin lesion that needs to be taken off, or if they've got a joint that needs to be injected, they have to transport that patient to my office. Previously, they did have to. And now we'll just set them up that when I'm here the following Wednesday, I'll have the medications here, I'll have the equipment here to do the lesion removal or the injection or freeze, the cryotherapy to freeze skin lesions off. So it will limit their travel considerably compared to what they had to do before, which cost the nursing home money. It took a staff member out of the facility to make that transport. It's not convenient for the patient who's maybe 90 years old, 85 years old, and in a wheelchair to have to make that trip rather than us just bringing them over here or us going over there.
We're really excited to have you
Yeah.
here. Is there anything you want to add?
No, the one thing is that some services that I think Knox County possibly haven't had in the county, because it's been a while since a physician was in the county seeing patients. Circumcisions, things like minor surgeries in the office, osteopathic manipulative treatment. Those things that patients from Knox County would have had to travel to get, they will be able to get here in the clinic because I'll be doing, you know, those services here now. It'll only be every couple of weeks, but it could be better than having to travel somewhere to have that done. So,
Dr. Davis, thank you.
yeah,
Thank you so much.
You're welcome. Good to see you again.
Good to see you.
Yeah. Oh, I've actually got my first patient coming in here at 1 o'clock.
I don't want to get any patients. I'm going to go out this door.
Okay.
And there's the Knox County Nursing Home. So, I mean, that really is accessible. That really is close. Thank you so much for watching this video. I'm going to go ahead and shut it down now. We're at the Edina Medical Services Clinic, which actually opened on June 1st. This was a ribbon cutting. A lot of people from Scotland County Hospital and Blessing Hospital here just next to the Knox County Nursing Home and across the street from the Knox County R1 School District Complex. So again, thank you for watching. I'm Echo Mendez for the Edina Sentinel and NemoNews.net, signing off for now.